I have a question for Ryan. Ryan, may I use my time to read the comments from the member of the community who wasn't allowed to speak?
If you wish to use it that way, you can do that if you like.
I don't need permission.
It's got to be related to the item. Obviously, I don't know.
It's related to COVID.
Yeah, if
because in the past, I have read things that we've all read things that people have sent us by texts, and since she came all this way, I think that I would like to use my time for that. Okay.
And you have my authority to do that. Go ahead.
Well, I didn't think I needed that authority,
You
but
don't, but I'm giving it to you.
all right. Well, thank you.
I'm a nice person.
Okay. Good afternoon, Chairman Bishop and Supervisors. As an employer, business owner, and resident of Mojave County, I'm surprised that I find myself there, before the Board of Supervisors. 6 months ago, on March 18th, Mojave County declared an emergency in preparation of a very destructive, deadly virus before it was even detected in our county. The full intent of this declaration was to open up a line of potential funding to prepare the county residents and businesses for an impending virus outbreak, to survey and mitigate the risks of overwhelming our healthcare system and maintain peace and order throughout the process. The objectives of the emergency order were achieved in April. 5 months ago, extraordinary precautions were implemented throughout the county. Governments, residents, and businesses took necessary precautions to mitigate the spread. The healthcare system never reached capacity or became overwhelmed, and many brought in patients from outside the county since their other services had been limited and they were trying to survive. It was never an emergency. It was in the long-term care facilities, and even those have leveled off and are back to normal medical transports. To date, the county has received $9.1 million in emergency funding to offset this crisis and has only allocated a fraction of it. It's not an emergency. Why has this emergency declaration not been ended? I watched the board and its health director speak last Thursday, September 10th, and I'm astonished by the tone and direction the board took in streamlining the process to shut down small businesses that are simply trying to make ends meet. There is no emergency. Why is the county harassing businesses trying to survive and put food on their tables? This harassment is so perplexing, falling short of specifically discriminating against certain businesses. The transparency of government has been lost. We cannot even get an accurate count of active positive cases within the county. The total cases over a 6-month period are completely useless. There is no clear sense of whether or not this disease is actually active, but the county has this information readily available. Why is the county not releasing this information? As an outsider looking in, it appears as though the county is trying to keep this emergency alive, long past the true need for such an emergency, and has reached the point that public trust in the government has been compromised. And if and when there is ever a need to have public compliance for any future emergency, the public is going to remember when the county cried wolf and not have near the compliance of the county initially had with COVID. Please stop harassing the businesses. Please stop trying to manage individual decisions. Regards, Amanda Kaufman. Thank you. And thank you, Chairman.
You're welcome.
Okay. Are there any other questions I can answer?
Yep. Attorney Esplin, could you answer the question from Ms. Kaufman? Why has this emergency declaration not been ended?
Well, I'm not a healthcare professional. I defer to the Public Health Department. I defer to the State Department of Health. I also defer to the governor, the various governors throughout the states, and the President of the United States. There's been a declaration made, and those who govern us, both on a local level, state level, national level, have determined that we still are in a pandemic and there's still a state of emergency, and those persons who have the authority to remove the designation of a state of emergency have not removed it. So it's still in place.
Thank you. And Denise, could you take the question as why the county is not releasing the information in regards to the accurate count of active positive cases within the county?
So I'm not sure that we're not doing that. Are we looking really at the difference between the confirmed cases and those that have recovered? That would actually, and minus deaths, would equal our active cases. So if that's a statistic that people would prefer be included in our fact sheet in more direct way, we can certainly look at doing that.
Okay, and then lastly, there was a question why the county is harassing businesses trying to survive. Could you point out the reason why the health department does what they do in regards to this?
Certainly. I think when it's public health's role to, of course, protect public health, which is a much broader statement than just looking at individual health care. So our role in the community is to ensure that people can remain healthy in our communities. So during this pandemic, some of the mitigation strategies and preventative steps that have been outlined before for you are reducing our case counts. And while not always the most popular, I recognize you can see within some of our epi curves that have been out in the public in our fact sheets that there is a correlation between the timing of the implementation of those and the results of those. And I realize there are other factors that play into that. I do. But looking at those strategies, those mitigation strategies and preventative steps, those are places that we really feel are important to maintain until we can continue to see these positivity levels go down, until we continue to see our case counts go down, which last week was a great reflection of that.
Okay, and do you think the county's trying to keep this emergency alive?
No, I don't look at it through that lens, I suppose. I think what I see is that the steps that are being taken are preventative steps, right? So what you've seen is that decrease in case counts, which has also resulted in decrease in deaths, and it's also resulted in decrease in hospitalizations, and our hospitals are back more at their normal levels of care. So the stress that's been on them for the last month, 6 weeks, 8 weeks, has been reduced significantly. So there's, again, a correlation there, and so we want to see that continue, and believe that masks are just a small way for us to protect our families, our friends, and those around us, our neighbors, and even people we don't know.
Okay, thank you very much. Does anyone else have any questions?
Madam Chairman, Gould here.
Supervisor Gould?
Thank you, Madam Chairman. Denise, do we know how many of our patients that are positive are asymptomatic?
Let me see if I can get that information for you, Supervisor Gould. And you're referring to all cases? Is that
Of the cases that are active currently.
okay? Yes.
Madam Chairman, I also have a question. For Ryan. Ryan, would a majority vote of the Board of Supervisors remove the state of emergency from Mojave County?
Supervisor Gould, that's a good question, and yes, it can be. If you look at the ordinance, two parts to this. One, under state law, local jurisdictions, the chairman can issue a state of emergency under certain circumstances, such as this one, but it's also subject to applicable law or subject to local law. Back in 1999, this board passed an ordinance. It passed an ordinance that specifically authorized the chairman the authority to pass a state of emergency, which she has done. She's done everything consistent with the law. She's followed the law. She's done exactly what the law says. And if you look at that ordinance, it also specifically states that the board by a majority vote could override or reverse what the chairman has decided. So yeah, the board here could vote and say we were going to remove the emergency here locally here from Mojave County. This board could do that. It's specific in the ordinance. It allows them to do that at any time. For the last 6 months, this board is authorized to do that. If the board wishes to do that, I'd recommend that you put it on the board agenda so that the board can properly debate it and properly pass a vote. But it would have to take majority of the vote, and it would only be for the state of emergency for here in Mojave County. I also just want to differentiate, that's the legal part of it. In terms of the pandemic and so on, that's the science and medicine of it that I don't have the qualifications to specify. I'm going to have to rely upon the public health director and the state health department and the other medical professionals to determine the state of a pandemic and so on. That's outside of that. I'm just talking about the legal nuts and bolts of it. Yeah, locally they could.
Okay.
I believe we amended that also so that a state of emergency could only exist under a pandemic declared by either the CDC or the Mojave County Director of Health.
I don't know if that's correct. I'd have to look at it. This was passed in 1999. I don't know if there's been any changes to it. I'd have to look to determine, but I actually think it's more consistent with what is specified in Title 26 of the Arizona Revised Statutes, but I'd have to double check that.
I remember walking out into the audience and chatting with Denise about how she wanted that phrased. Whether that motion passed or failed, though, I don't remember. I lose so many times that it all gets muddled. Thank you.
Sure.
Okay. Denise, do you have any comments on that?
I don't remember, honestly. It's been some time, so I need to read through that, and I will defer to County Attorney Esplin to provide an opinion on that.
Okay.
Madam Chair, I believe
Supervisor Angus, go ahead.
4 or 6 weeks ago, I made a motion that we lift that emergency. So I think we already attempted it, and I'm probably going to do it again. I mean, depending on whatever the outcome is. It didn't pass that time.
Actually, I don't think you made a motion. You made a comment that there was no reason to make a motion.
I don't recall. I don't know.
Remember, maybe we can look into that, but you're saying right now that somebody can make a motion.
Yeah, I'm just following what the law is. I'm following the law. The law is very clear, and I have to emphasize and stress, Chairman Bishop has followed the law here. She has followed exactly what the law is, and this is the law.
Anyone's challenging that.
I know, but this is an audience that everybody's watching here. I want to make sure that the people know that Chairman Bishop has followed the law, and so has the board, and not just these people, but so that they understand that this board has passed laws in 1999 that specifically said this. They're following the law. So if the board wishes to declare that the emergency is removed, then you can do that. You can do that. It's just, you just got to follow the law and follow the procedures. In 1999, an ordinance was passed consistent with Title 26 of the Arizona Revised Statutes that allows the chairman to pass it subject to the board convening, and the board can override that. You can do that at any time, and any board member can bring that before the board. That's what I'm trying to say.
Okay, and I'd just like to point out that even though my being the chairman and declaring this emergency has nothing to do with me personally, if the board by majority vote wants to end the declaration of emergency, I think it should be placed on an agenda so we can debate the pros and cons and find out exactly what that means when we do end this emergency, if we end it before the governor ends his. So that'd be my recommendation. Supervisor Watson.
Thank you, Chairman Bishop. Ms. Burley, at what point in your position do you feel that it would be prudent to lift our restrictions? There's got to be a time of relative decline, or statistically the numbers come in.
Sure.
But at what point is it logical to make that recommendation?
Supervisor Watson.
I know you're just kind of caught off the cuff here, but at some point in time we do need to take a look at it, and I would like to have your opinion before, as a health expert.
Certainly. You know, I think that there are, as we continue to see cases decrease and we continue to see the percent positivity decrease, I think the reasons for that continue to be the steps that people are taking to continue that effort, the mitigation strategies. But without a vaccine or some other form of treatment, the virus will remain out there in the public and circulating. So without taking some of these mitigation steps and using these strategies, I feel like we're just kind of setting ourselves up to go back up again. And that's the prediction. And again, prediction based on our past and our experiences both with the state closure and then the mask proclamations. If we look at them there, you've seen the epi curve and the waves. And those are what we would be looking at moving forward without some of these steps. So whether or not you need an emergency order to do that, and what extra powers or steps that gives the board, or whether or not we continue on as public health to ensure the messaging is out there on what steps have to be taken. I don't know if there's some separation there, I guess.
And I understand that there's some concern of a second wave or somewhat of a genetically altered new portion of this pathogen. Is that correct?
There is. I mean, there's always mutations that occur over time. And I think the other real concern is that as we move into flu season and we see the potential for dual illness, a person getting flu and COVID could worsen the symptoms and be more difficult for someone to fight off. So all of these steps that we're taking here, the masks, for example, at least in the southern hemisphere where they've just gone through their flu season, have reduced their flu numbers down significantly. And so it has the potential to do the same for us. It has these masks, I realize, again, popular or not, that's not where I'm at. You know, my view is just through a public health lens, and they are working to prevent the spread of illness, and that includes the potential for flu in the fall and the winter.
Thank you, Ms. Burley.
Mm-hmm, certainly.
Thank you,
Madam
Chairman.
Chair.
Yes, go ahead.
Thank you, Madam Chair. This question would be for Ryan. We need the emergency declaration along with the state's emergency declaration to get federal funds. Isn't that correct?
Supervisor Johnson, the question, if I understand correctly, the question is if we need the local emergency declaration and the state emergency declaration in order to receive federal funds. I don't.
Yes.
I think that was the general thinking that we had back in March, but I don't know if that's for certain. I don't. You'd have to look at what the federal funding required. And I mean, I'm guessing that that's probably what they required, because they're not going to give something if you don't have a local emergency and so on. So, I think that's probably correct. I just don't know for certain. I don't have that in front of me to determine whether that is correct. But I think that's essentially what we were looking at back in March.
Thank you.
Anyone else? Questions, comments? Denise, do you have anything further?
I do not, no.
Okay. Thank you very much.